The Helping Young People Choose the Birth Control Method Right for Them resource tutorial is a 5-part tutorial developed by Activate. Activate is funded by the Office of Population Affairs to translate sexual and reproductive health research into resources for professionals supporting young people experiencing the child welfare or justice systems, homelessness, or disconnection from school and work.
Activate previously developed a resource that professionals can use to facilitate conversations with young people that center young people's birth control preferences, needs, and priorities. The purpose of this tutorial is to illustrate how to use the resource. It was developed with input from youth supporting professionals who might use the resource and young people who might benefit from its use. The Helping Young People Choose the Birth Control Method Right for Them resource is a 2-part research-informed resource created by Activate. The resource is designed for youth-supporting professionals who want to help young people make informed decisions about birth control. The first part of the resource is the Birth Control Methods Guide that includes instructions for using the guide, background information, reflective questions, conversation starters, and a matrix that includes 18 birth control methods. The background module reviews what we know about the factors that influence young people's choice of birth control methods and describes the different categories and methods of birth control found in the resource. Modules 1, 2, and 3 show how the reflective questions, conversation starters, and matrix can be used.
The second part of the resource is a booklet that includes detailed information about the 18 birth control methods featured in the birth control methods matrix. It also includes a glossary of reproductive healthcare terms, such as long-acting reversible contraception. Module 4 shows how the booklet can be used. We developed the resource using a 4-step process. First, through Activate's needs assessment, we identified a need for a resource that helps youth supporting professionals empower young people to choose a birth control method that is right for them. Second, we reviewed the literature on factors that influence the birth control choices young people make. Third, we sought input from youth supporting professionals and young people on the content and format of the resource and how it might be used. Finally, a pediatrician and public health professional with expertise in adolescent medicine and pregnancy prevention reviewed the resource to ensure its medical accuracy. This is the background module. It reviews what we know from research about the factors that influence young people's birth control methods choices and provides information about the different categories of birth control methods included in the Birth Control Methods Guide and Information Booklet. Module 1 describes how to use the self-reflection questions in the Birth Control Methods Guide. Module 2 explains how to use the conversation starters in the Birth Control Methods Guide. Module 3 explores how to use the Birth Control Methods Matrix in the Birth Control Methods Guide. And Module 4 illustrates how to use the Birth Control Methods Information Booklet. After completing this module, you will know what research says about how young people make decisions about birth control, what the different categories of birth control are, and what birth control methods are included in each category. Let's start by reviewing what research says about the factors young people consider when choosing a birth control method. Choosing to use birth control and choosing which type of birth control to use are extremely personal decisions. No birth control method is right for everyone, and what works best for one person may not work best for another. Young people need medically accurate information about the full range of birth control options to make an informed choice about which, if any, birth control method to use. Research suggests that young people consider several factors when choosing which birth control method to use. This includes the attributes of different methods, such as side effects, effectiveness, cost, effort involved, and user control, contextual factors, such as reproductive history, relationship characteristics, previous birth control experiences, and attitudes towards pregnancy, and peer and social influences, such as facts and experiences provided by peers, family members, and healthcare providers. Young people prioritize these factors differently. We acknowledge that a young person's birth control choice may not always align with their preferences due to systemic factors. Most of the research on factors that influence young people's choice of birth control methods has focused on cisgender women. Cisgender men have largely been excluded from this research, although some studies have examined the role that cisgender male partners of cisgender women play in choosing a birth control method. Young people who identify as lesbian, gay, bisexual, transgender, queer questioning, or gender non binary have also been excluded from much of the research on contraceptive choice. Many researchers incorrectly assume that these young people are not at risk for pregnancy and exclude them from studies as a result. This reinforces assumptions about the normativity of heterosexual relationships. Comparatively few studies have looked at the factors that are most important to the birth control choices of Activate's population. Young people who have experienced the child welfare or justice system, homelessness, or disconnection from work and school. When the birth control choices of these young people have been studied, the samples were small and non representative. Hence, the findings may not be generalizable to the larger population. Although research on the factors that are important to the birth control decisions made by Activate's populations is limited, some evidence suggests that their contraceptive choices are influenced by the same factors that influence the contraceptive choices made by cisgender young women in the general population. These factors include the experiences of family and friends, the responses of their partners, and how easy it is to maintain use of the contraception, side effects, insurance coverage, and pregnancy attitudes.
Now let's discuss the 5 different categories of birth control methods from which young people can choose. Each of these categories is included in the Birth Control Methods Matrix and the Birth Control Methods Information Booklet. The 5 categories are long-term reversible, short-term hormonal, short-term barrier, short-term behavioral, and permanent. Now we will provide a brief overview including examples of each category. Knowing about each of these categories is important for youth supporting professionals who are helping young people choose the birth control method that is right for them. Long-term reversible birth control methods are the most effective methods. These methods are inserted or injected into the body by a healthcare provider and are invisible to a partner. These methods typically last for several years and can be removed at any time. Long-term reversible methods include 2 types of intrauterine devices, or IUDs. IUDs are placed into the uterus by a healthcare provider. Another long-term reversible method is the implant, which is placed under the skin of the upper arm by a healthcare provider. Short-term hormonal birth control methods use hormones to prevent pregnancy. They are not quite as effective as long-term reversible methods. Short-term hormonal methods require some action by the user on a routine basis. For example, taking a pill or inserting a device daily or every few weeks or months. Additionally, as of the time of this recording, a healthcare provider must prescribe these methods. This can be done via telehealth appointment or by a pharmacist in some states. However, there are current efforts to expand access to making the pill available over the counter. Short-term hormonal methods come in several forms. The 2 most widely used short-term hormonal methods are the injection, also known as the shot, which lasts 3 months, and oral contraceptives, more commonly known as the pill, which must be taken daily. Other short-term hormonal methods include the transdermal contraceptive patch, which is worn on the body, and the contraceptive ring, which is placed inside the vagina. Emergency contraceptive pills contain the same hormones as other short-term hormonal birth control methods, but are designed to be taken soon after unprotected sex, not every day. Short-term barrier methods prevent pregnancy by blocking sperm from fertilizing an egg. They are hormone-free but less effective than short-term hormonal or long-term reversible methods. Individuals must remember to use these methods each time they have sex. Short-term barrier methods include the diaphragm, cervical cap, sponge, and spermicide. The diaphragm and cervical cap require appointments with a healthcare provider to be fit for the device. Spermicides should be used with a diaphragm or cervical cap. Barrier methods also include external or male condoms and internal or female condoms. The condom methods prevent sexually transmitted infections but should be used in combination with other methods to prevent pregnancy. Short-term behavioral birth control methods require users to alter their behaviors to prevent pregnancy. They do not require a visit to a healthcare provider or pharmacy, and they do not have any cost. However, these methods have the highest failure rates when they are not used perfectly. Perfect use is using a birth control method consistently and correctly every time. By contrast, typical use refers to how people use the birth control method in real life. Some examples that inform a person's typical use are there limited knowledge about menstrual cycles, cycle irregularities, or a person's inability to avoid intercourse during peak fertility times. Short-term behavioral birth control methods include fertility-based awareness and withdrawal. Permanent birth control methods require a surgical procedure that permanently prevents sperm from reaching an egg during intercourse. These methods are highly effective at preventing pregnancy and are generally not reversible. Permanent birth control methods include tubal ligation, more commonly known as getting one's tubes tied, and vasectomy. Activate's Birth Control Information Booklet provides more information about all of the birth control methods mentioned in this tutorial. The attributes of birth control methods, as well as peer and social influences and contextual factors, all influence the birth control choices young people make. Most research on birth control choice has focused on cisgender women. Although research on the factors that are important to the birth control decisions made by Activate's populations is limited, some evidence suggests that their contraceptive choices are influenced by the same factors that influence the contraceptive choices made by cisgender young women in the general population. The birth control options available to young people fall into 5 broad categories, and it is important for youth supporting professionals to be familiar with all of them. These are the citations for the research referenced in this module.
We would like to acknowledge the youth supporting professionals and young people with lived expertise who contributed to the development of this tutorial. Please contact Activate using the email address listed if you have any questions about the tutorial. All 5 of the tutorial modules can be found on Activate's website at activatecenter.org.